In this first playlist, we're going to be going over the health plan. Two health plans, your choice, through United Healthcare. As I said earlier in the intro video, the plan year for all the plans is going to be May 1st. And it's going to run through next May 1st. If you happen to be a new hire, then you'll just pick up the plan on the first of the month after the hire date. But it's important that you cannot change any benefits until next May 1st unless it's a qualifying event, as I said earlier. The way you want to look at this health plans are A, for office visits, B, for hospital, inpatient, outpatient services, and C, prescription drugs. So this is going to give you a very a good overview of all of the benefits for medical. But does it have everything? No, we have other documents on Employee Navigator that you can download, like the summary of benefits and coverage and more details on the plan. But those are the A, B, C. And then don't forget that anytime we have a highlighted area, that's going to be your website to find doctors. So you want to go to myuhc.com, and then don't forget to look at United Choice Plus plan. The Choice Plus is a very robust network. It has a lot of facilities you can go to and doctors, but make sure every doctor, every urgent care, every hospital is in this website, United Choice Plus plan. Plan 1 is the BJEQ. Plan 2 is the BJCK. Those are just the plan codes to the plan. But Plan 1 is kind of a lower level plan, still a great plan, but Plan 2 is better. Okay, and you're going to see that reflected in the price as well. So A, office visits, you're going to see has a $40 copay for primary and an $80 for specialist. Whereas Plan 2, the BJCK, is a $25 copay for primary and $50 for specialist. So it's important that you know the difference between the plan when you sign up. So, and then you can start looking down at each benefit. Like, for example, annual preventative checkups are going to be free on each plan. Okay, that is an ACA law, the Affordable Care Act law, that all preventative checkups have to be free under the ACA website. It's called healthcare.gov. You can type in keyword preventative and find out which preventative is free. Okay. Then it gets into chiropractic and physical therapy. C stands for chiropractic, PT stands for physical therapy, so you'll know how much you're going to pay at each of those visits. Mental health, you can look at what copays are for mental health. Then when we get into hospitals in Section B, know that, first of all, everything is the lifetime max is unlimited, which means this is another ACA law, which means that you will not have a lifetime max. You will not have a limit to what your benefits will cost for your whole lifetime. They can't cut you off at a certain dollar amount. The annual deductible on Plan 1 is $3,000, and on 2, it's $1,500. So again, lower deductible, lower copays on Plan 2. Plan 1 has a per occurrence deductible only for hospital-based deductibles. So if you go to a hospital, they're going to put a $250 deductible more per occurrence rather than the annual deductible. And this annual deductible is calendar year on line 6. So it does reset in January. Even though we have a plan year of 5-1, I know that's confusing, but it's still an annual calendar year deductible. Co-insurance is a little more confusing, but it is 30% after your deductible. And then the out-of-pocket is $7,900. So you can think of this in terms of, okay, when I go in, I have a $3,000 deductible right out of the gate. Then I have to start paying 30% after, but you shall not go over $7,900, including everything. And that's including copays and prescription drugs and everything. This is a catch-all. That's the $7,900. Now, if you go over to Plan 2, it's $5,500. It's a $1,500 deductible. You only spend 20% co-insurance to $5,500. So it's a lower maximum out-of-pocket for Plan 2. Out of network, I just wouldn't do it. I would really try to stay in network if possible. I know some people go out of network by mistake, and it's because they don't look at this website and look at United Choice Plus and make sure their doctors and urgent care and everything is in there. And then they end up getting an extra $1,000 bill from an anesthesiologist, and the patient had no idea that the anesthesiologist wasn't in. So it's very important to look in network. Because these are separate deductibles. So you have a separate $10,000 deductible if you go out of network, in addition to the annual deductible on your own sick. So it is a severe, highly expensive deductible if you choose to go out of network. Prescription drugs are going to be the same on each plan. It's a tiered prescription. Tier 1 is 15, Tier 2 is 45, Tier 3 is 90, and Tier 4 is 350 per prescription, okay? The way this works is probably a lot of generics would be in Tier 1 or Tier 2, and then the higher level drugs would be Tier 3 and Tier 4. Where those drugs are, you can go online and go to myuhc.com, and then you want to look at the Tier 4 Advantage PDL. If you can't find it, you can certainly email us, and we'll send you a PDF of the PDL. And you can search all drugs that are under Tier 1. You can search by diagnosis. You can search by drug name. There's lots of ways. But arguably, there's drugs in Tier 1 that do the same thing as Tier 3. Tier 4 are the very, very expensive drugs. That's the ones that are exponentially expensive. All right, so that's really the way the drugs work. And we just went over the ABC of the health plan. Now we'll go over to Employee Navigator, and I'll show you what this screen looks like. I'm in step 3 here. I already filled out my personal information and dependent information, so now I'm going into medical, and I got just as a test here, I got myself and my wife on here, and I signed up for Plan 1. That's the one I selected, and then I do a save and continue, and then I'll move on to the next screen, which is the gap insurance, which I'm sure a lot of people do have questions on the gap insurance because it really ties in well to the medical. So we're going to be talking about that gap insurance next, and thank you for watching this video, and we'll see you on the next video. Thanks.